Hello everyone, we are Group 5 and this is our PowerPoint presentation on creating a healing environment for West Boca Medical Center. My name is Sarah and I'll be presenting West Boca's physical and metaphysical environment. West Boca Medical Center is a hospital part of Palm Beach Health Network located in Boca Raton, Florida, and they've been serving patients since 1986. This medical facility offers a variety of specialized healthcare services, some of which include orthopedics, emergency, general surgery, intensive care, labor and delivery, and even a level 3 NICU. A majority of the patient population includes white and Hispanic ethnicities, as well as those who are 65 and older. Most of our group members have had clinical here, so this grants us a first-hand perspective on the current conditions and quality of healthcare at West Boca. When looking at West Boca Medical Center's infrastructure and physical environment, this hospital is relatively small, offering only about 195 patient beds. They do have outdoor seating connected to a cafeteria, but there's very limited green space or greenery for healthcare workers and patients to enjoy. The outdoor seating just has metal chairs and concrete flooring and no surrounding plants. If we take a look at the hospital's medical surgical unit, there's a mix of both private and shared patient rooms, with the majority of them being shared. And when two patients and all their medical equipment are in this shared room, this increases the patient's risk for falls because there's a lot of obstruction of pathways leading to the bathroom and around the bed. There are also heavily tinted windows that only allow limited natural light in for patients. And since rooms are shared and separated by a curtain, one patient will have their natural light blocked, as you can see in the picture. Additionally, during the day shift, this unit can become very loud and busy. There's constant sound of bed alarms, infusion pumps, chatty visitors, and healthcare personnel having rounds near the nursing station. Additionally, the nursing station is small and has very limited seating, so there's no designated seating areas for nurses to sit and chart. So what nurses have to do on this unit is find a room with only one patient in it so that they can find a place to sit and chart. I've personally heard complaints about the noise level and patients' difficulty sleeping, and noise pollution contributes to patient fatigue, anxiety, and it can worsen depression. So this is definitely a problem that needs to be addressed. One way to improve the physical environment of West Boca is to increase the number of private patient rooms. Private rooms reduce the risk of falls because there's less clutter, and it will help patients with noise pollution. With this potential solution, the hospital would need to expand the size of their units to accommodate more patients and more rooms, but it would come with so many benefits for the patients, so it should be done. The hospital can also install windows that are less tinted, that let in more natural light, and this is a good idea because it regulates circadian rhythm. Natural light improves circadian rhythm, which improves mental and physical well-being. The hospital can also create designated quiet times, post them on signs throughout the unit, and this would just enforce a period of time where there would be reduced visitations, reduced noise, maybe dimmed lighting, which would improve sleep quality for patients, and that promotes physical and mental healing. Building desks with computers and seating scattered throughout the unit would give nurses a place to rest, chart, and not disturb patients since they don't have to go into patient rooms anymore. If there's any type of group rounds or staff meetings, they need to be done in conference rooms instead of the middle of the unit, which would reduce noise. And lastly, adding greenery to the cafeteria outdoor space would promote rejuvenation and relaxation among workers and visitors. Analyzing the metaphysical environment of the hospital, there are some aspects that could be added in order to improve patient healing. This hospital does have a small chapel that is accessible through the main lobby for anyone to use. I think it would be even greater benefit for the hospital to hire more chaplains and spiritual counselors, which can visit patients in various units who request their guidance. The addition of a quiet room could also help serve as a space for patients to go and meditate, pray, or relax. Both of these interventions would contribute to spiritual healing, which is so important because you need to address the mind, body, and soul of patients to create wholeness that eventually makes healing possible. The units could also incorporate nature-themed artwork in patient rooms and in hallways, and these additions evoke feelings of calm and peace, especially during times of stress and illness for patients. Staff could also be trained in guided imagery, breath work, and meditation exercises so that they can teach patients who struggle with pain or if they need some type of distraction. West Boca Medical Center does do a good job with incorporating music therapy for their patients, as they do have a TV channel that is easily accessible that includes classical music and nature sounds.
Hi, I'm Lily, and I'll be presenting cultural environments. When it comes to assessing any healthcare facility, one will easily come across a wide variety of cultural beliefs, specifically within the patient population. This can include values, morals, traditions, and religious or spiritual beliefs and practices. One of the most relevant cultural connections across the West Boca healthcare system is the abundance of patients who identify as part of the Hispanic or Latino cultures. These cultures make up 15.4% of Boca Raton's population census, according to the United States Bureau. The clientele of West Boca Medical, however, comes from more cities than Boca Raton alone. This census increases to 24.5% when looking at the entirety of Palm Beach County. This is approximately just over 377,000 individuals who identify with these cultures residing in the county of Palm Beach. Another population that is abundant within the city of Boca Raton in the county of Palm Beach is the Jewish community. According to the Jewish Federation of South Palm Beach County, in 2023, the Palm Beach County community represented just over 230,000 Jewish individuals. Education is the first step in developing strategies to promote healing and wellness within the healthcare system. A lack of education on relevant cultures and beliefs can lead to an experience for the patient that may seem uncomfortable, impersonal, and can even lead to negative effects on the promotion of healing. With proper cultural education, promoting care for patients can be individualized and unique, creating a healing environment where they're able to be viewed and cared for as their own person and not just a bed number. This includes hospital meals, caring techniques that may correlate with one's beliefs and values, having interpreters readily available for patients who may need one, or even simply spending time with a patient to understand their other individual needs. This promotes respect and compassion when providing care. A possible implementation to improve care within this facility and others is to host and promote cultural education courses, which faculty members can attend in order to learn more about care techniques and backgrounds, beliefs, and values of different populations. The promotion of family involvement also plays a huge role in the promotion of healing and wellness. When family and friends are involved in the care process, culture and beliefs are brought together and are strengthened in unity. As previously discussed, West Boca is a relatively small facility with limited green space and not much additional seating and space for family and visitors outside of the patient rooms. And the additional space that is available is uninviting and arguably uncomfortable. Improving and expanding these spaces would be very beneficial for the promotion of patient healing through the unity of cultures and family involvement. More ways to promote family involvement within the patient care is, with patient permission, involve the family when it comes to bedside rounds or other interdisciplinary meetings. Informing family members and patient caregivers outside of the medical facility about the plan of care for the patient can promote consistent treatment following, as well as improving mental health. This is all within the patient consent release form, of course.
My name is Maria, and I'm presenting on West Boca Medical Center's technological environment. Specifically, I will discuss how advancing the use of technology can improve patient care, staff efficiency, and overall satisfaction. There are many technological innovations in effect at West Boca Medical Center, but there are still opportunities to implement new technologies that will enhance healthcare professionals' workflow and patient outcomes. The hospital could offer a telehealth follow-up visit at discharge, especially to patients with transportation challenges. This would allow the patients to contact the provider from the comfort of their home, while the physician monitors patients' recovery, responds to questions and concerns, and verifies adherence to the care plan. Updating the TVs in the patient's rooms and providing more entertainment options could improve patient well-being during their stay. Even though entertainment is not essential to care, it can increase patient satisfaction by promoting non-pharmacological distractions to pain and stress. The organization could upgrade the phones used by the staff to a newer smartphone with the option to text the physicians, access patient portal, and healthcare apps. This would improve physician-nurse communication, creating more efficient treatment and better experience for the patients and the staff. It would be beneficial to integrate a nurse informaticist to create an app in which patients would not only have access to labs, but to medications, appointment reminders, nutrition, and hydration tracking. This would ensure medication adherence, especially to older adults in the area that may have issues remembering to take their meds. Finally, improving access to an interpreter app would guarantee prompt communication between the patient and the nurses. Instead of relying on a limited number of interpreter devices in the unit, nurses would have access to an interpreter on their phones. This would address language barriers more efficiently and allow nurses to have easier access to interpreters in emergency situations. When advancing new technologies in the area, it is important to note that the West Boca population is made up of a majority of older adults, so it is crucial that healthcare professionals and patients receive appropriate training on how to incorporate these innovations to their daily routines.
Some socio-political factors that can influence health are income, education, housing, and access to affordable healthcare that is safe. Income is a large concern for many, especially if they do not possess quality insurance or any insurance at all. Education can hinder access to healthcare as many who are not properly educated may not know when to go to the hospital or doctor's office. They may also not know about medical policies. In the long run, this can cause more confusion or more expensive hospital visits because the patient may have more acute problems as they waited too long to seek help. Housing, similarly, can cause health problems if the patient lives in an unsafe environment. During COVID-19, for example, vulnerable populations such as those experiencing housing insecurity were disproportionately impacted by COVID-19, including effects on health outcomes such as hospitalizations and mortality. Also increased during the pandemic were gender inequalities and family violence. This ultimately led to more mortality and hospitalization among those experiencing social determinants such as loss of income, lack of access to hospitals, and housing instability. If affordable healthcare is available to patients, is it safe? Both patients and providers must ensure the quality of these options. Community engagement can certainly improve access to healthcare for those with lower education status or those experiencing unsafe housing environments. West Boca Medical Center engages in community outreach and advocacy efforts often. Recently, they completed their Heart Walk, where they donned red shirts and walked to raise knowledge and funds for awareness of signs of cardiac arrest, stroke, and heart attacks. They also organized a juice box toast at the Boca Town Center Mall to discuss their opportunities for pediatric care and to bring in the new year, advocating for the infants and children of Boca Raton. Some policies that can create a more healing environment are visiting hours, smoking policies, and safety drills. Visiting hours at West Boca Medical Center end promptly at 8 p.m. with a warning over the loudspeaker at 7:30, urging families to say their goodnights. This allows the hospital to become more quiet at night to promote quality of sleep for the patients, as well as safety. Like all hospitals, West Boca Medical Center also has a no-smoking policy for the safety of both patients and staff. This includes electronic vapes and similar items. If one is found, it is promptly taken to security with a patient label and stored so that the patient can gather it when they are discharged. Safety drills are completed often, such as fire drills and evacuation drills with the staff. The fire doors are tested regularly, and staff complete training every few months to touch up their knowledge in case of what to do in a fire, flood, or similar disaster. Policies, advocacy, and community engagement can all improve access to and knowledge about healthcare and overall improve community health in Boca Raton and West Boca Medical Center.